At this time, we're going to break down the two different ways that you can get your Medicare and look at some of the pros and cons of each one. Let's focus first on original Medicare. There's a line in the center of the screen, and above that line would represent how original Medicare works with supplements and Ds, and below that line is how Medicare Advantage works. We're going to focus on original Medicare. Let's say that you had visited a doctor or had a hospital expense under original Medicare. They would send the bill either to Part A or to Part B of Medicare, depending on whether it was a hospital claim or a medical bill. Medicare would then pay the doctors and hospitals the portion that they would agree to cover, and technically you would be responsible for the balance. That's why people under original Medicare many times purchase Medicare supplement policies. With that in force, Medicare would pay towards the claim first, and then Medicare would forward the bill directly to the Medicare supplement policy, and they would pay also on the claim. So you have both Medicare paying on the claim and a Medicare supplement policy paying on the claim. That can leave little or maybe even no out-of-pocket expenses. If you take your Medicare under original Medicare with a supplemental policy and you want prescription drug coverage, you would need to purchase a separate Part D plan because original Medicare nor a Medicare supplement policies cover drugs. The benefit to original Medicare paying and a supplement paying is there can be little and sometimes even no out-of-pocket expenses. The con to that side would be you're paying a little bit more premium to get that type of a policy. So those are the pros and cons of original Medicare and a Medicare supplement. Now let's examine our Medicare Advantage or Part C of Medicare. Look at the same scenario. You visit a doctor or have a hospital bill, but this time you're in a Medicare Advantage plan. Although A and B Medicare is still there, it doesn't disappear. You're not disenrolled from Medicare, you're simply enrolled in a Medicare Advantage plan. So the doctors don't send the bill over to Medicare. They bill the plan directly to the Medicare Advantage Part C plan. So they send the bill directly to the plan. The plan pays back according to the outline of benefits or the evidence of coverage booklet, and then you pay whatever copayment or out-of-pocket expense that the plan tells you for each category of service that you might use. The positive or the benefit to these Medicare Advantage plans is you pay money into Medicare for your Part B premiums. Some people have the state pay it, but in any case there's money going into Medicare. Instead of Medicare using that money to spend it to pay claims to doctors and hospitals, what Medicare does is they pay subsidy money directly to the companies who run these Medicare Advantage plans. So they compensate those plans for the administration. Those plans take the money that they get from Medicare, they cover their out-of-pocket expenses, and they make a profit on administration. The benefit of a Medicare Advantage Part C plan is the fact that because Medicare pays these companies, you can enroll in a very low monthly premium. In some cases, in some counties and states, there's literally plans for zero premium. You don't have to pay anything other than what you're already paying into Medicare. The con to that would be when you use doctor services or hospital services, you might be responsible for more of an out-of-pocket expense than you would in the other scenario that we talked about under a Medicare supplement. So for a person that's using very small amounts of services, a Medicare Advantage plan becomes very attractive because you can be enrolled for a very small premium and you can pay an out-of-pocket copayment that can be very reasonable, $15, $20 for a primary care physician, $30, $40 for a specialist. You might pay a few $100s for the first few days of the hospital, but the coverage can be very comprehensive if you have a large amount of out-of-pocket expenses. They do have out-of-pocket limits that can apply. So again, looking at the two different types of Medicare, Medicare with a supplement has two insurances paying. There can be little or no out-of-pocket expenses, but you pay more premium. Medicare Advantage plans, you can be in for a very low premium, but you might pay more when you go to use services. So those are the breakdowns and the pros and cons between the two different types of ways that you can get your Medicare. And we're going to go into just a moment how to start taking the time to decide which way you want to go.